Hey, look out. It's Faith Talk Live. I'm Rick Probst.
And I'm Dan Ratcliffe. Happy Friday.
Hey, look at those smiles. That's Claudia and Dr. David Cantrell. We love these guys. How are you guys?
Good.
We're good. It's Friday.
Yes, that's what I always say. It's Friday.
What does that mean to a doctor? I've always wanted to ask that question. Oh, not really. I'm lying now. But what does Friday mean to you, Doc?
2 days off, just like anybody else.
Yes.
That's exactly right.
Awesome. Well, we want to catch up with you. One of my questions, which I'll ask later, is about what you're going to do, where you're going to go when all is said and done and everything's fine. But we'll get into that in a second. All right, Dan, this is to you. Claudia sent me a message this morning, and she said, "Are we still on?" Okay. You know, out of the two of us, you and I, who is the one most likely to kind of mess up the texts and put in strange words in conversation?
You know, not to throw any shade, but it would be you, Rick.
Yeah, yeah. Well, Claudia is the winner today. Listen to this.
Oh boy.
She says, "Hi." She says, "Hi, Rick. You want David and I to join you and Diane at 10 a.m.?"
I've been called a lot of things, but Diane has never been one of them. That's great.
That's good.
I wonder if the cat's out of the bag now. Is there something I don't know?
I wasn't going to tell anybody, but I guess Claudia has revealed my secret.
That is so awesome. Listen, you guys, if I had $1 for every time that happened to me, because I usually text or send a message, don't even read it. I just send it.
Yeah.
And it's gotten me into trouble. So many times. Well, we wanted to catch up with you guys. Doc, how's things going on your end? Last time we talked to you, you were right in the midst of everything still going in the office. I'm thinking it was what, Dan, somewhere around April, maybe?
Yeah.
March.
Yeah, right around April.
How you doing? How are you guys doing? How are you doing?
We're doing very well. In April, we were early into the pandemic, still learning a great deal about the virus, how to handle it, how to prevent spread. At this point, we've learned a great deal more. We are extremely busy in the office. We do internal medicine, so there's a lot of patients that have to be seen regardless. But we've instituted CDC protocols for safety in the office, the transition of patients through the office, sanitation of the rooms, et cetera. So we're very busy. That just adds to the level of care that we're providing on a day-to-day basis. So it just kind of ramps things up even more.
Yeah, I was in your office just a couple of weeks ago, actually, for just a checkup, and everything. Everybody had masks. Everything was clean, and I was very impressed with how it flowed. And it was pretty full. There was a lot of folks there.
Yeah, we stay very busy all the time. We're a very busy practice.
Yeah, definitely.
I didn't realize, Dan, you saw Dr. Cantrell. I didn't realize he was.
Actually, I see one of his partners, Dr. Cantwell, which sounds very much like Cantrell, so it gets confusing sometimes. But yeah, they're in the same office.
Hey, Doc, and I do want to talk to Claudia here in a second, but we do want to kind of catch up with you on this, because I really feel like, we all really want to know. Of course, things change, as we progress. Some things we thought, and then they kind of changed up. I just think that's just the nature of the beast in a sense. Who could pin down what exactly and how you can actually catch this thing? The anxiety level on patients, is it still the same? Has it lowered? Is it getting higher? What do you see?
There's still a lot of anxiety that we see because of the possibility of getting the virus and the unknowns that we had to begin with. But I think people are beginning to understand the extreme importance of wearing masks, particularly when you're out in public. We're kind of edging back out into closely to normal activities. The importance of washing your hands repeatedly or using a hand sanitizer, and then the social distancing. Those three areas are of most importance at this time. Testing is available to anyone through the public health department as mandated by the state. So a lot of people are getting tested. And then we begin to put some of that data together. But the anxiety level has not changed a great deal. People are still very frightened.
I was watching the Today Show this morning, and it may have been Dr. Fauci, I'm not sure. But it's an estimated between now and December, they say 300,000 deaths possible. But if everyone wears masks, it could, and this sounds bad the way I'm going to say it, only 70,000 will pass. So masks are very, very important. Hey, we got to do what we got to do, right?
Absolutely. Masks are crucial, and that's a problem that I see being out in various areas. People need to remember that when you wear your mask, you're protecting someone else. If someone else is not wearing a mask, then they are not protecting you. So it takes everybody wearing their mask out in public to help cut down the spread, which is a major way we can end this thing.
Now, Claudia, in your coaching practice, part of coaching is counseling. Do you see people a lot with anxiety and fear to kind of move forward with all this, or what are you seeing?
No, I really don't. I'm coaching them around what's next and what do I do now, and
right.
They're really not talking about COVID at all. It's not that type of stuff they're looking to do. So I don't see the anxiety there. I've got people looking for jobs, and I'm coaching them on job hunting and the careers, and so they're not really talking to me about that.
Okay.
Has there been a lot of shifts? Now, obviously, you can see Dan and I are still working. Thank God for technology. But there are a lot of job loss. The folks you're talking to, Claudia, are there a lot of holes out there? We're hearing it, seeing some of it. I know the serving industry, because our oldest son is a server downtown. What does it look like on your end? And what are you saying to those folks on how to move ahead?
I'm coaching honestly, a lot of 20s. They're coming out of college. They want to change the career. They're thinking they really don't want what they majored in, things like that. But I'm also on LinkedIn, and LinkedIn sends me probably 5 or 6 a day that need professional career coaching. And that's just LinkedIn throwing it to a lot of coaches and seeing their submission on the proposal. But we see it constantly coming in from LinkedIn. So I would say there's a good bit out there that is really in need. There's a lot of people in need of a career or a job. They're coming out of these jobs when they got laid off and quarantined, and then saying, I don't know that I want this job anymore. I don't think I like this anymore. So there's that part too. And then the part that says, well, you're not going to have a job again. So that's 2 different issues, but we can coach that as well. I've got a lot of 20-year-olds or in the 20s right now that just want to find their place.
We're talking with David and Claudia Cantrell, and Claudia has recently started her life coaching practice and is getting ramped up. David, what kind of change did you see in Claudia after she went through the training? Because it's a lot of training. It's a lot of stuff to take in, and it a lot of times will change you. What have you seen in her as she's gone through this?
She has gone through a lot of training, over a year of intense classes and studying and working with the program with groups together. I've seen her get very tired because she worked very hard. I've also seen her test out some of her discussions and questions on me, and I have to remind her, you're not coaching me now. We're just a regular evening. I'm doing well.
And you found out you wanted to be a circus clown, not a doctor after all. So, right? I mean,
I remember asking him one day, because we were thinking about what is he going to do in retirement.
Yeah.
And I said, so what matters? And he answered it. He didn't realize that's a coaching question, but we always say, what matters?
Yeah, that's funny.
So does that help you now? And there's another question I want to ask about having to retire. And I want to pick a little bit in there. We do have about a minute or two, but does that help you being so? I mean, David's right there. He's your husband. Obviously, he's going to answer honestly. Does that help you in your growth and your skill and your practice, Claudia?
Oh, it does. If I ask some coaching questions, it's really great. I have some friends that'll call and they have some problems, and I don't say I'm asking you a coaching question, but I don't really answer it. I put it back on them, and that's what a coach does. Mm-hmm. So we ask the questions and let them pull from their own resources inside themselves, and they're able to do that. So a coach gets you further faster, but we don't give you the answers. They're inside of you, and so that's what's fun. I have had a lot of clients really find some things out about themselves within 3 weeks, and they're absolutely floored about it. It's amazing. A lot of people that I'm coaching right now didn't realize that they were actually linking their identity, their value, and their worth to what people thought. And do that because people are going to change, and they're not. The one day they're going to have a bad day, and they're going to say something ugly to you, or they're going to say, "I didn't like that presentation," or whatever it may be. But when they really realized they were linking everything that made their day, good or bad, into whether they pleased someone or made their day or made them happy, that was a huge revelation, and it was very freeing. And I've got 3 like that right now, so it's interesting. You don't realize it's everywhere.
So if you're answering questions with questions, David, when you ask her where does she want to go for dinner, is there a question? Well, where do you want to go for dinner? What matters to you?
Absolutely. I turn it back again.
Exactly.
I love it.
That is so funny. That's the age-old question, right, Dan?
Yes, it is. Where do you want to go for dinner? I don't care. Where do you want to go?
Yeah. We joke about this all the time. We've got to take a break here in just a second. But Claudia, is it ever too late? I'm 60 years old. I want to be a doctor. Is it too late for me? I just want to feel like, no, but serious.
On television, so I'll say no comment.
That's a good political answer, Claudia.
You know what? If that's your dream, we'll work on it. That's all I can say.
No, but seriously, I mean, I don't want to be a doctor. I don't have what it takes. But if there is something that, let's say I lost my job tomorrow, and of course, depending on my skill, I mean, obviously it's not a general rule for everybody, but at 60, is it too late for me, or can I look and say, you know what, I've still got another 15 years I could, do whatever?
Oh, it's not too late. Absolutely not. We can figure out, what matters to you at this time, what do you really care about, and then move you forward from there. It's a wonderful process to see you decide what you really want in life. There's a lot of people, coaching, you stop there. Coaching is for the person who says, I've got some pain, I've got some discomfort, and I want to get rid of it. So it's the person that's got pain and discomfort. Let's get it gone. And let's go to a coach to help me do this. Or it's the person that says, I want to finally fulfill my dream and a goal and a desire I've never had time to do. Mm-hmm. So you come to a coach because there's pain and discomfort, or because there's a huge desire that you need to have fulfilled. Mm-hmm. It's never too late. You can do some wonderful things. That's never the problem. And we can work with you with that. That's easy.
Yeah. That is so good. I want to be Dan Radcliffe, so see if we can work that out. Nobody has a voice like Dan Radcliffe.
He does have a great voice.
Listen, we love you guys. The website is there, CantrellChristianCoaching.com on the screen. Check it out. And we have been praying for you. Doc, you where you are there in the midst of it. Claudia, you as well. We want you to be healthy and strong. You guys are an amazing blessing to so many people and to the body of Christ. Just keep being you and just touching so many lives. Your imprint is huge. Hey, let's take a break. We will be right back. I'm Rick Probst.
And I'm Dan Radcliffe.
This is Faith Talk Live.